Good afternoon, everyone, and welcome. My name is Megan Akins. I'm the Director of Strategic Partnerships and Gender Equality with the Canadian Partnership for Women and Children's Health, more well known perhaps as CanWaCH. My pronouns are she, her, and hers, and I have the privilege today of joining you from Deep River, Ontario, which is located on the unceded territory of the Algonquin people. So we have a diverse group with us today, but the largest of folks identifying that they're coming from small and medium NGOs. So welcome. And again, in terms of the type of areas that we work in, a good mix predominantly of both programming, M&E, as well as research and development, amongst others. So it's always just great to have a sense of who we have joining us, and we're really looking forward to a rich discussion today. So to set the stage for why we're gathered here today, the COVID-19 pandemic, it's certainly no secret and no surprise that it's had significant economic, health, and social impacts on the lives of women, two-spirit, and gender diverse people across not only Canada, but across the globe. We've seen the pandemic bring about gender inequalities by exacerbating increases in cases of sexual and gender-based violence, an increase in unpaid care burden in both healthcare settings as well as households, a decrease in access to sexual and reproductive health and rights, maternal, newborn, child health services, as well as WASH provisions, and a significant reduction in opportunities for income-generating activities in the informal sector due to lockdown measures. While there have been many significant negative impacts and implications for women and gender-diverse people, in many ways, this pandemic is offering us a moment to rethink the ways in which we work and engage across all sectors, in particular with regards to research, project design, and implementation. Today, during this webinar and over the course of the next 56 minutes, we'll discuss the importance of gendered research during a pandemic and why taking a feminist approach to recovery is necessary to improve gender inequality in order for women, girls, and gender diverse people not only to survive, but also to thrive in both global and local communities. I hope this webinar will be the first of many discussions and will spark ideas and connections, and also provide some practical solutions on how we can build back better and strengthen pathways for effective, equitable, and intersectional research, both globally and here in Canada. I'm looking forward to sharing and for us to share with one another and having a fruitful discussion and question and answer session with you all over the course of the next hour. Before we get started, we just have a few little housekeeping items that we wanted to cover. The first is with respect to Zoom, the platform on which we're all joining today. Please note that this webinar is being recorded and the recording will be circulated to participants tomorrow. And also as a note, we're asked that you not share any sensitive information or documents in the chat box, given that that's accessible to everyone who's joining today. Today's webinar will include a question and answer session. You can submit anonymous questions during the presentation using the Q&A button at the bottom middle bar, or if you'd like to would like to speak or ask a question during that Q&A period, please simply click the raise hand in the webinar controls at the bottom of your screen. The webinar host will then take you off mute at the appropriate moment so that you can ask a question directly to the panelists. If for some reason you're having any technical difficulty at all during this webinar, please simply write a message to Tina Larochelle, our technical support, in the chat box. And I just wanted to note, you've probably noticed on the bottom of your screen that today we are offering closed captioning for this webinar via Google Slides. This is one of the first times that we are using this feature in a webinar, and we recognize most certainly that it's not perfect. At this time, it is only available in English and only captures the speaker's voice, so punctuation and accuracy will not be entirely accurate. And we just thank you all for your understanding as we test out this tool. Today, to start, we will begin with a short presentation by Shiva Mazuri from YWCA Canada, followed by an interactive panelist discussion with an integrated Q&A from the audience. I would like to introduce you to the moderator of this panel, Anjem Sultana. Anjem is a policy and strategic communications at YWCA Canada. She holds a Master's of Public Health from the Dalai Lama School of Public Health at the University of Toronto and has published several peer-reviewed research articles examining health inequities and the social determinants of health for women, immigrants, racialized communities, and young people, both in Canada and globally. Thank you again for joining us all, and I'm going to turn it over to you, Anjem.
Thanks so much for that kind introduction, and it's such a pleasure to be here in partnership with CanWaCH for this webinar. I was speaking earlier with the organizing team that we started to see discourse in Canada talking about the gendered impacts of the pandemic, which is good, but we haven't really done a deeper dive into what the implications are for research and knowledge production, and that's what the hope of this panel is today and this session, along with my colleague's presentation shortly. And I think, you know, one of the things that we've seen is just how unpaid care work has really impacted women and gender diverse people's experiences in the labor market and just contributing to society because of that unequal division of labor. And we've actually seen this starting to see this show up in academia. We're seeing actually some initial preliminary findings that women who are in academia are actually submitting less research articles to peer-reviewed journals. We saw something similar come out in Nature, for example. So I think we're seeing all of these social, political, and economic forces that this pandemic has brought forward also impacting knowledge production. So I think it really requires us in this moment to really examine that deeply, and I'm hoping this panel will start to do that. I want to take this moment to introduce our incredible panelists who will be sharing their insights and giving us things to think about as we move forward. So I'd like to begin with the first panelist to introduce them. So if we can advance to the next slide. Great. So Shiva Mazrui is my colleague at YWCA Canada. She is our research officer, and later today she's going to be doing a presentation on a project she's been leading with our team members called Born to be Bold. She has been doing national research on women's access to gainful employment and focusing on the barriers that are creating additional barriers to the work that they want to do in employment and labor market. Shiva has led various initiatives and events focused on women's experiences, equity, and inclusion in her work in both the nonprofit and humanitarian sectors. Her passion and work has centered around themes of equity, belonging, education, mental health, and migration. So really looking forward to her upcoming presentation. I'd like to introduce the next panelist as well. Dr. Monica Malta, and Dr. Monica Malta is a global health scientist and who currently works at the Center for Addiction and Mental Health, CanWaCH, and the University of Toronto. She is on the leadership board of 500 Women Scientists, a grassroots organization representing thousands of women scientists all over the globe. So we're really excited to hear that global perspective. Her research focuses on health inequities faced by people living in low and middle income countries. And during this pandemic, she's been doing exemplary research examining what is happening as it relates to mortality in Latin American countries, as well as what domestic violence is looking like for women, girls, and gender diverse people during these lockdowns that we've seen here in Canada, but across the globe. So really looking forward to Dr. Monica Malta's comments and remarks. I'd like to introduce the next and final panelist, Allison Riddle, who is a research associate and a PhD candidate in the School of Epidemiology and Public Health at the University of Ottawa, so a fellow public health colleague as myself. And her work currently as a research associate is at the Brewer Research Institute. Allison has over 20 years of experience in the fields of gender equality, women's empowerment, and global health. She's a former diplomat with the Canadian International Development Agency, now known as Global Affairs Canada, where she managed health and gender equality programs and served as a gender inequality advisor for 13 years. She spent a time at this, as a senior country manager for Gavi, the Vaccine Alliance, managing immunization programs in Eastern, Southern, and West Africa. In addition to her PhD studies, Allison also works as an independent gender equality and global health consultant with Canadian and international organizations, including Gavi, USAID, Nutrition International, and Stanford University. So we're glad to have Allison as well as part of this panel to talk about her multifaceted experiences, both in academia, but outside of it as well. So without further ado, I'd like to pass it over to my colleague Shiva, who'll be talking about Born to be Bold research. One of the interesting research projects that we're doing that has started before the pandemic is continuing on during the pandemic, and we're excited to see what happens hopefully as we get to the other side of this crisis. So without further ado, over to Shiva.
Thanks so much for the introduction, Anjum, and thank you so much all for having me today. I'm really excited to share with you a little bit more about our project and our research at YWCA Canada. So we can start right away with the PowerPoint. I'll try to keep it short and sweet. So our project is titled Born to be Bold, and I'd like to start off, I always like to start off just by positioning myself, just so you get to know a little bit more about the person in the random box speaking at you. So I was born in Iran, and my family and I immigrated to Canada about 20 years ago. So I've spent the majority of my life, I grew up and pursued higher education in Toronto and Montreal. And the experiences of being a young woman of color who has pursued higher education in what is currently called Canada, those are all experiences with which I approach my work and my research. So moving on to talk about research a little bit broadly before we talk about Born to be Bold specifically, so we can go to the next slide. Why, I just always like to start with the question of why gather data? And you'll notice this as a pattern. I pose a lot of questions. I don't necessarily have the answers. I just like asking questions, which is why I'm in research. So why is research important, and why do we need to gather data? And one of the most important aspects is that we really can't treat what we don't know, and we can't really talk about what we don't know. So research gives us that insight. And it can help us improve our advocacy and target interventions. It's always important to note that research can be a very impactful tool in that way, but it can also be a very harmful one or a dangerous one. And there is definitely extensive history of harmful and dangerous data collection, particularly often in Black and Indigenous communities. And we have a history of colonial research and data collection. So one of the main, I think, ways of looking at research, and one of the main questions to consider, is how we can really decolonize research and data collection. And one thing I like to always point folks to is the Ocap Principles. They're the principles of ownership, control, access, and possession that really, that means that First Nations can control their data collection and the process in their communities, and have access to decision-making regarding why, how, and by whom information is collected, used, or shared. So moving on to Born to be Bold and the next slide. So Born to be Bold is a cross-country research to identify promising practices for increasing made vulnerable women's access to gainful employment. And gainful employment is the term that we're using to talk about employment that offers consistent work, job security, work that's free from forms of violence and discrimination, for women to really be able to maintain and sustain meaningful living. So moving on, an overview of the project itself. We're collaborating, YWCA Canada is collaborating with 10 YWCAs in 9 provinces and territories to reach about 6,000 service users and program participants. We're engaging 5 national employers to commit to systemic change for made vulnerable women. And really the overall goal of this project is to increase financial independence for women in Canada and really build community awareness and change attitudes of leaders of business to better engage made vulnerable women. So going next, why this research and what do we already know about women in the labor market? This is a very high level overview. We know there's definitely much more than this that we could talk about, but 82% of women in Canada participate in the labor market compared to 91% of men. Looking at that further, only 76% of Black, Indigenous, and women of color participate in the labor market and the labor force, but they're 10% more likely to hold a university degree. And according to a 27 McKinsey global estimate, Canada's GDP could grow up to $150 billion by 2026 by advancing women in the workforce. So there's also that element to why. So how Our process, this is a 3-year, 3-phase project that we've undertaken. So the first phase is really looking at the research piece and the design piece. So we begin by designing our research methods, the tools and protocols that we'd be using. And then we moved on to carrying out the data collection. So we used a mix of quantitative and qualitative data methods to collect data, looking at women's experiences accessing work in our 10 participating sites, and moved on to analyzing that data to then post an initial report with key promising practices that we found for increasing access. And that interim report is currently available on our website. And now we're moving on to phase 2, which really is the pilot phase of our project, to really evaluate those promising practices that we saw coming out of that first phase, to see whether they have the saliency and whether they really are these promising practices we claim them to be, before then moving on to phase 3, which is to really share and engage in knowledge dissemination. So we have a knowledge mobilization campaign planned, online training modules to really build sector capacity on the promising practices, to then really be able to hopefully scale up and increase the impact of those practices. So moving to the next one, the research process, and really going into a little bit more of the detail of that first phase. We start off by reviewing what do we already know, what data already exists, what information do we have access to. Then we moved on to the design of the process. So really looking at developing the ethics framework and how we carry out our research ethically, and really what the informed consent process would look like, and questions of recruitment. So who gets to participate, why and how. Then we defined our research methods. And as I mentioned, we used a combination of qualitative and quantitative methods. So for our case, we used a survey, focus group discussions, interviews, and even had digital methods of engaging if folks wanted to engage in that way, and really developed our research tools and the activities that we would undertake. A key part of the research process was also the definitions. So really defining who we mean by women, what we mean by the labor market and success, what we mean by gainful employment. And this is where we recognize the definitions of work and the labor market also reflect a colonial worldview. So we are talking about the labor market as it exists and accessing it as it exists. So really defining the key terms and the community of interest and who benefits was a key part of that research process. So then moving on, what are outcomes for the research engagement in phase 1? We had 196 women who participated in 23 focus groups and 48 interviews in 9 of our 10 total sites. Through the survey, we also engaged 211 women and survey responses from women in 9 of the participating sites. And we received 1 digital story, which was really exciting because I really wanted to have different ways of engaging folks beyond your traditional survey and focus groups. So our initial findings, what those led to, and I'm going to skim over this, but if you do have questions, I'm happy to answer them in the Q&A afterwards, because I can really talk about this for a long time. But the overarching theme that came out of our findings was that we really need to take a holistic and person-centered approach when talking about accessing the labor market. Although many women might share similar experiences, there's really no single solution or approach to women's access to gainful employment. Every individual woman is different, and they're impacted by the same policies in different ways. But some of the main barriers that we found in accessing gainful employment for women, as you can see, they go around a variety of factors. So income and housing, access to childcare, transportation, really the ways the systems and structures that we currently function in and that currently exist really impact women's ability to either access employment or to even be at the point of considering or applying for employment. Skills, education, and experiences, whether that's foreign gained experience, lack of professional experience, lived experience not being accepted, those all pose major barriers to access. And we have, of course, trauma, mental health, and abuse all playing huge roles in impacting women's ability to access gainful employment. So then moving on to the rest of our initial findings, what were the promising practices? And we came up with right now 4 broad categories of promising practices that now moving into phase 2 is when we'll be piloting to see their saliency. But the promising practices, the 4 themes, the first was flexible work arrangements. So that's flexible work schedules and locations, and also really providing the necessary tools for women to be able to work remotely. So this can be a variety of things like flex hours, leave days, flexible working conditions, so remote work. The second broad category was childcare and transportation, which has also come up quite a lot throughout the pandemic as well, and prior to the pandemic. Really access to free or low cost, safe, affordable, non-discriminatory childcare and childminding, providing accessible, affordable, and safe transportation options. And again, that can look at number of different ways, whether it's on-site childcare, subsidies, and so on. Continuing with the findings of the promising practices, the third theme is really around education, experience, and skills. So things like recognizing lived, diverse, and foreign experience when looking to hire women. Providing paid training, placement, and learning opportunities is a huge factor because then women are not forced between choosing an income and being able to advance or upskill. And the fourth and final category is peer programming and communities of support. So a promising practice was peer-led programs. So programs that are led by folks who have shared experience or have that lived experience as to what they're offering. Cohort-based models so that that sense of community and network can be built amongst the cohort members, and really providing one-on-one support to navigate all of the possible resources that exist. And finally, an important part of the entire research process and how we've gotten to this point and moving forward is really to recognize our limitations, whether that's in developing research or even in our own research. We really do recognize some of the limitations. So we always like to ask questions and adjust. One is around accessibility. How accessible is our data collection tools or research methods? Whether we're using, if it's surveys, is the wording accessible? And that's something that I've had to learn, is to really move towards more accessible language, whether it's access to technology or internet, or how we're collecting the data. Questions that I always like to pose whether looking at research processes or outcomes is who's missing from our process, who's missing from our data, who's missing from the outcomes, and who really benefits from our research and the outcomes. So going back to the goals of what this project was, looking at who is benefiting from the outcomes of our research. And another critical final question is, how do we define our terms? So like I mentioned, there are limitations, of course, to the ways that we define the labor market, for example, or even for us, it was really important how we defined women and made vulnerable women in undertaking this particular research. So it's important to always just recognize limitations, ask questions, and then define and broaden the research based on that. So thank you so much. I hope I didn't go over my time, but I'm happy to answer any questions afterwards in the Q&A.
Thank you so much, Shiva. That was excellent. And I think what it did was really set up the stage for the conversation we want to have around how we do research, what this pandemic is showing us, and how we want to move forward at a macro and micro level. So at this point, I'd like to bring in the whole panel for our conversation. And you know, one of the things we're noticing at YWCA Canada and similarly for CanWaCH is there is a lot of things happening by government and different stakeholders around how do we build back better? How do we actually take this moment and actually ensure that equity and inclusion is at the core of what we do moving forward? And research is a critical piece of the puzzle. Because right now, you know, just-in-time research is what's driving policy decisions that will have impact for years to come. So I was hoping, you know, the first question directed at Dr. Malta. We've seen in this pandemic a range of different gendered impacts, and Megan at the start of the session talked about a few. I was wondering if you can share more about what you're seeing as it relates to COVID and domestic violence, and what you're seeing in Canada in particular, and any lessons you have for us as you've been doing that research as the pandemic is happening. Over to you.
Thank you. First, I want to say it was an amazing presentation, and most of all, I'm looking forward to what's going to foster down the road. I'm pretty sure you have amazing data, and it's going to be really, I want to follow it. It's It's really, really amazing. Yeah. So domestic violence, when the public health measure asks everyone to physical distance, to shelter in place, you stay home. For some, that means you're gonna stay most of your days, if not month, with an abusive or violent partner. In some countries around the globe, we are seeing threefold increase in the prevalence of gender-based violence during the COVID pandemic. For instance, in Latin America, in Brazil was the country with more transgender homicides in the world before the pandemic. The Latin America accounted for 70% of all the murders of transgender and non-binary people all over the world. And Brazil alone responded for 40% of those homicides. During the pandemic, Brazil is up to almost 50 or 55% of all the homicides we have been able to track among only transgender and non-binary people. So yes, domestic violence is increasing a lot during the COVID. Well, here in Canada, we saw the Minister of Women and Gender Equality. She was telling us that it might be around 20 to 30% increase of gender-based violence and domestic violence in some regions of the country. But the data is not all available yet, so we don't know for sure what are the figures. We also saw some shelters in the GTA area telling that they had up to 100 or even more increase in calls, while other shelters in rural areas were surprisingly empty and without any calls at all. However, it's also important for us to think that fewer calls doesn't mean that there is no incidence of violence or domestic violence at all. It might mean that someone is being on surveillance 24/7, living with an abuser, and this person cannot call or look for shelter at all. Some others might not know where to look for care or where to ask for any shelter. Are the shelters open or not? Or if they are open, is it better for me to stay in my place with an abusive partner, or to be there in a shelter where I might be getting COVID? So there is a lot going on for those people who experience violence and domestic violence. Some cannot call, some others are just afraid to go to shelters. The pandemic doesn't make the violence stop at all. It just makes it more silent. And in some instances, it can make it really worse, as if you stay home with a violent partner, or some transgender and non-binary or LGBTQ2S needs to go back to a transphobic, homophobic home. So you don't know what's going on. So bottom line, it is increasing. We don't know the extent of it, but if anyone listening to this webinar is experiencing any unsafe in their house, it's important to say that if your safety is more important than wondering about COVID-19, especially in Canada, because we have a pandemic that is under control. So if you need if you are under any physical violence, or you need to call, you can look for assistance through sheltersafe.ca and inviolencecanada.org, or you can follow up with us.
Thank you so much, Dr. Malta. And I think what you have also demonstrated and highlight is the ethics of research. What does research tell us, and how do we ensure that we are driving towards actions and responses that protect the public good and people specifically who are experiencing a range of systemic barriers. So thank you so much for sharing that research. And I think what this is also highlighting is research tells us what is happening. It can be descriptive. Research can also tell us what works well or what is promising. So some of the work that Shiva was pointing to that YWCA is doing in phase 2. But I think to really understand the full reality, the full truth, we have to ask the right questions, and we have to actually ensure the process is as inclusive as possible as the results or what the outcomes are. So the next question is directed at Shiva. So one of the purposes of this session is to do some lessons learned around how do we make research inclusive? And how do we strive towards being intersectional and feminist, but what does that actually look like on the ground? So I was wondering if you could share a bit, perhaps through the work that you've done or lessons that you've seen other colleagues take on. What are the tools and supports we need to put in place to make those aspirations a reality?
Great. Awesome. So how do we make research intersectional? Great question. And anytime we talk about intersectionality, I like to kind of go back to where the term came from and what it really means. So really just kind of going back, like many of the great social movements and definitions and concepts, intersectionality was actually coined by a Black woman, a Black scholar, Dr. Kimberly Crenshaw, a Black legal scholar, and it was coined in 1989 to really describe how race, class, gender, and other individual characteristics intersect with one another and how they overlap. So she's explained it as a prism for understanding the way multiple ways of inequality can sometimes compound themselves and create obstacles. That's not often understood by looking at things in a conventional way. For example, let's say feminism, so looking at just the gender experience. So really with intersectionality, I think that gives us a great basis to start off from when we're thinking about research or outcomes or even developing our tools and questions. It's questions to ask at every level. Are we understanding experiences from a trickle-down approach where we understand it from, this aspect and then this aspect, and then maybe we can add the two and try to understand how it impacts people from the different groups, and to really understand, are we actually looking at understanding the ways that these aspects have compounding effects and impacts. So really thinking about our tools, are they qualitative and quantitative? Who will access them? How will folks engage in the data collection? Who will collect the data? How and why? Who will interpret it? And those all, I think, will impact the ways the research that we are able to do and the outputs that we're able to compose. And another question to, I think, always ask is whether we should be the ones conducting the research. Are we the best placed? Are we the right people to be doing that research? And if we're not, if we realize that we're not the right people or don't have the right relationships to the community, what tools do we have at our disposal that we can offer to those who might be better placed to carry out the research? So that could be things like funding, training, software, and space, even physical space. So how can we support those who might be better placed to do this work than we are in carrying out this really truly intersectional research? And then really to ask, okay, who do we want to benefit out as an outcome of this work, and really centering them or partnering with them in community to carry out the research process. And that looks like building trusted relationships to really continuously learn and adjust as we learn more and adapt our tools, really be willing to learn that we might make mistakes, and really how can we adapt it to then be more accessible in our approach. And I think a great approach to that is community-based participatory research, which oftentimes it's really equitable in the way that it involves all partners and community members in the research process, beginning to end, and it really recognizes each partner's unique strengths. So from the design to the collection, to the data processing, to the sharing, it's really an equal partnership. So the questions that you can always ask is who's making the principal decisions, who's getting the funding, who has control, and really why. And those questions, I think, often will help us to be able to understand how we're engaging with the subject that we're looking to better understand through research. And as I also mentioned, decolonizing data, I think, is also another approach and another aspect of data collection and research that we really need to start considering. So why are we gathering the information? Who's interpreting it? And does it really truly serve the communities? And Ocap, as I mentioned, is a really is a great way where First Nations communities are really doing that data collection and interpretation for their own communities, and that makes a lot more sense. So, and finally, I think one way is to really think about transparency. So who has control, who is conducting and leading research, and who has access and ownership to the information that's collected, because oftentimes that's something that that's where we can miss a lot of information. That's maybe somewhere where somebody can look at the data and say, well, it affects women in this way, and might not interpret the data to see how it affects women of color or older women, or whatever kind of compounding factors you want to look at. So really accessing the data and having access and control to that, I think, is an important aspect of intersectional research.
Thank you so much, Shiva. I think you've given us a lot of food for thought. And I think one of the key pieces is you have to ask the right questions, and you have to really examine every step of the research process. And I think something inherent in what you said is also this idea of power and control, and who gets to make the decision, and who does the research benefit. So thank you so much for really outlining that. And I'm curious to also see, you know, are there other practices that fellow researchers in this session are taking on to make research really, truly intersectional? So thank you for giving us that comprehensive kind of analysis, but also those tangible steps that we can take. So the next question is directed at Allison, and we've started to take a look at what's happened in Canada, what's happening globally. We talked a bit about what happens on a research process or project itself. I'm wondering, given your international experience, how do we make research more inclusive in that realm? People that are doing, you know, international-based research, and how do we mitigate the risks while amplifying the good? So over to you.
Thanks, Anjum. It's a good question, and actually what I have to say very much builds on what Shiva has said, and it's this idea. I've been doing some work on developing guidance for stakeholder engagement in the development of clinical practice guidelines, and, you know, working with patients and patient engagement. There's been a lot of work on that, and there's a phrase that our patient advocates will use, and I just think it encapsulates it well, and it is, you know, nothing about me without me. And that, taking that premise and using, if I'm using the language coming from that world, it's about the idea of co-production of research, co-production and co-creation, where it's a real partnership between the stakeholders, those who are affected by and may benefit from what you're researching and what you're trying to achieve, and the researchers themselves. And that partnership includes a role for stakeholders and beneficiaries throughout the research process, from the very definition of what will be researched and the research questions, to the design, data collection, analysis, discussion, and dissemination. And there's, you know, there's growing guidance on how best to do that. And that's something that we were working on for guideline development, but can also easily be translated for global health research. Shiva brought up community-based participatory research, which I think is sort of the epitome of a best practice around how to be inclusive and to do research that is co-produced with communities. And there's a great book that Nina Wallerstein wrote. I think it came out, or she edited with some colleagues in 2018 on community-based participatory research. And it's about advancing, so, you know, the sub-theme is advancing social and health equity. So there's a direct link there in terms of equity and inclusiveness. And that was sort of my second point, which relates to what Shiva was saying about intersectionality, and it's the idea of applying an equity lens to the design and interpretation of research. We use, as part of the Cochrane and Campbell Equity Methods group, we use the Progress Plus framework to guide us through identifying potential socially stratifying factors that we should consider when we're identifying our research goals, and the partners and the stakeholders that we should be including, and then also how to then interpret that evidence using an equity lens. And There's a good paper by Jennifer O'Neill that came out in 2014, I think, that we can share with everyone about the Progress Plus framework, but also the Cochrane and Campbell Equity Methods group is a great resource as well, and something to look at. And then I was thinking about, you know, how do you reduce harms? I think one piece that is often overlooked, especially in the international development community when we're doing formative research, is ethics approval. And the importance of getting independent review boards to examine the research that is planned, and because that's the goal of ethics review, is how do you minimize harms, right, and maximize benefits. And I think often, due to a variety of reasons, especially in the practical world, not academia, but when you're doing formative research for new programs or projects, there's often, you know, restrictions on time and personnel, and going through an IRB takes time. But again, that points to the importance of having local partners that have a true partnership with, who can help work through that with you in the countries that you're working. I think it's a really important and often overlooked step in doing formative research for programs in international development.
Thank you, Allison. And I appreciate the specific resources you mentioned, but also zeroing in on the ethics process, because that should be at the beginning. That is often the first step, but if that step is not correct or not done in an inclusive or intersectional manner, that has repercussions down the line for that initiative or project. So thank you so much. At this point, I want to open up the next question to everyone, all the panelists. And this is around connecting research to policy, or translating knowledge into action. So from your experiences, both within Canada and globally, what are some of the pathways or promising practices you've seen for effective, equitable policies through research? So essentially, how have you seen research actually drive change? And what actually made that happen? So maybe what I'll do is I'll start with the same order in terms of questions. So I'll start first with Dr. Malta.
Okay, so we work a lot in Latin America, and the first initial step is to gather the community and identify key partners in the country where we are working. To work with the LGBTQ2S community, we work with the Brazilian Transgender Association, with the Brazilian LGBTQ Association, and researchers who are based in Brazil. If we go to Argentina, if we go to Uganda or Mozambique, we're gonna work with researchers who are there, because that speaks with what Shiva was telling us about decolonize the research. It cannot be from north to south. That doesn't work. What work in Canada is not going to work in the US, or what work in the US is not going to work in Uganda, and so on and so forth. So we need to have not only the ethical approval, but we also need to be based there and not just make research that I think is going to work in Toronto and take it to Argentina or to Mozambique. That's nonsense. And I also think that another thing that is really missing is the leadership. When we think about, for instance, the WHO and those big organizations, if we look into their COVID emergency committees, they have 20% of women. If you look into the US broad response, they have 10% of women or any gender diversity on board. When you have a committee that is setting the rules, what are gonna be from now to on, if you don't have a diverse members speaking about the LGBTQ community, the Black community, the immigrants, and so on and so forth, you miss a lot in the guidance, in the policies. and you end up with guidance that is going to work just for one group and not for all the others that are really missing the equity piece.
Thank you so much. Shiva, over to you.
Thank you. And Dr. Malta really hit on a lot of the key points. So I'll be echoing a lot. And like I mentioned, I'll be posing more questions in response to your question, but I think it's important to be asking these things along the way as we're thinking about designing those equitable or policies or interventions. And I know this might seem like a no-brainer, but I think we really need to base our interventions on the actual outcomes of the research and the data. Oftentimes, I think research and data is collected, but due to whether it's time constraints, financial constraints, whatever it is, the interventions don't actually tend to act on the data or the impact based on the impact that comes out of it. So really basing our interventions based on what the research tells us, but also to consistently analyze the research and the outcomes from a critical lens. So really asking those questions of who was missing from the process, who was missing from the outcomes, or who was centered in the process. I think another question to ask ourselves often is when we're thinking about interventions or policy is, what do we count as acceptable research and data when we're looking for that information to inform our actions? Does the information already actually exist and we just don't see it as acceptable or legitimate? So does it really need to come to you in statistically significant ways, or are you considering experiences and different stories and different modes of sharing that information as data? And it's really important for us to kind of remember that information is a really powerful tool and a really powerful resource to really treat information in that way. To look at the data that already does exist, is it disaggregated? So can we understand the impacts on different groups so that we can really target interventions and have targeted interventions? When thinking about policies and interventions, do we have a long-term plan for them, or are they short-term strategies? Are we considering the root causes of whatever it is we're researching, of whatever intervention we're planning, or are we just thinking about what can get us to the next stage? So those are questions to always kind of ask if we're really thinking about having those impactful interventions and policies. Go back to your key terms, look at the data you're looking at. What were the key terms? How were they defined? Do they line up with what you want to impact and the policies you want to impact? I think those are all things that can start us on a way of having more targeted and impactful interventions.
Thank you. And over to Allison.
Thanks. Well, as a recovering policymaker, I have an interesting perspective sometimes bouncing between having been in the policy world and now in academia. And obviously there's a big gap in terms of how those two worlds work. And, you know, the reality is that policy is not solely based on evidence. You hope it's evidence informed, but there are usually a lot of other factors that are feeding into how decisions are made. So I think researchers need to be cognizant of that process. And again, it goes back to stakeholder engagement and understanding who are your knowledge users, and understanding what they need to make their decisions. So it's that consultation at the beginning when you're developing research to understand, you know, what they need to make decisions and to help that to inform how you shape your research. Another, you know, really big challenge too, though, is and then how you communicate that research to them. It can't be a 200-page systematic review. It needs to be a 2-page policy brief that gives them very clearly, this is the evidence, this is what we found, these are the implications, here are some possible recommendations. Very pithy and in their language. So I think that's really important to bridge that, that divide. And then the last one I would think about is time. And the type of evidence, as Shiva was saying, you know, you don't always have time for a cluster RCT or an RCT. Are there other ways that we can do research more quickly that's going to actually respond to policy needs? So things like rapid reviews that are being done now by Cochrane to inform the response to COVID. But when you do that, you see loss of opportunity for equity and intersectionality and engagement. So I know the work that's being done in terms of doing all these rapid reviews around COVID-19, it's been important, yet a struggle to get stakeholders that are not researchers engaged, such as patients, getting patient advocates part of that research process. So, it's a real challenge to make sure that when you're responding to urgent policy requests like COVID, and you need to get the research done yesterday, how do you get them to add that equity and gender lens onto it in a meaningful manner? And so there has to be some give and take. It's not easy.
Thank you. And I think each of the panelists talked about just the specific challenges and about, how research can actually be used for that ultimate good and what are the pitfalls and also strategies along the way. I think also, Allison, your comments just now actually set us up really well for a question from the audience. So far, I just want to say this has been a fascinating conversation, and really, I hope I'm taking away a lot of questions, as Shiva has mentioned, to really ask for the types of research, for example, that we use in policy and that policy work that we do. So yeah, so just want to say thank you. The question here, and I think this really speaks to what Allison's saying around what is happening during COVID and what is being sacrificed or potentially could be sacrificed in the effort for expediency to respond to the challenges that we're in. So, this is a question for everyone. How do we conduct a gender analysis during COVID-19 for a new research project? Does the panel have any tips or best practices? The questioner has this example. We have only been able to do key informant interviews, but we have not been able to do a lot of other types of consultative work with women's organizations. So any tips, practices that you've kind of taken on to address that gender analysis for a new COVID project? So I open the floor to everyone, whoever wants to respond. Okay, maybe Allison, go ahead.
I can kick it off. It's an area I'm still trying to understand and to be able to provide better guidance to partners. What I've seen is those who already have existing relationships seem to be doing a little bit better. In this case, when you don't have an established footprint, and especially a local partner who can really take the reins when you can't be on the ground, I think it's more of a challenge. My research focuses on adolescents and nutrition and their empowerment. And so I've been looking a lot at the GAGE program, and they actually just came out with a toolkit for conducting virtual research. Now, again, they have an established presence, but they have done an interesting review of how can you use mobile technology to reach. And again, when they're doing research in low and middle income countries, and they're targeting, some of the most vulnerable adolescents, 15 to 19 years, those with disabilities, those who are young mothers, pregnant, just very or other marginalized groups. So I think looking at their work is quite interesting and something I want to explore more about how they are doing their research, because they have been doing a lot of focus groups on the phone and using mobile technology. There's some equity issues there too. Kids can't actually get access. There's real concerns about privacy, depending on what you want to talk about. So I think that would be really interesting to dig more into. And I think Johns Hopkins recently came out with some guidance as well. I can, when we send our follow-up resources, maybe I can see what I can find there in terms of how to do work in this context. It's something I'm still trying to figure out what are the best practices.
That's helpful. I know Dr. Malta, I think you wanted to share some insights as well.
Yeah, I think that this person could try to do some mixed methods, and I know that Hopkins has some data on gender and COVID, but it's based for the US. I don't know if it's gonna answer Tina questions, but another strategy, as Allison said, use the internet and to try to pull some quantitative data. Everybody's online. A lot of people are still home, so you might be able to have not only the key informant, but a little bit of quantitative data. That's for sure.
And Shiva?
Yeah, I can just kind of add on to what's already been said. I know the COVID-19 situation is very particular and, you know, rapidly changing. So it is hard to think about how to best gather that data and do that analysis. Like Dr. Malta said, a lot of the data already does exist. And I think that's why there was a lot of push for collecting both gender-based but also race-based data, so that there is a database that already has a lot of that information. But one of my recommendations would be to see which community organizations are doing that work or already do have access to that analysis or that data, and to see how you can partner or support their work. So potentially you might not be able to engage them in your own research collection, but are there ways that you could be supporting other analysis that that communities that already have that kind of access or that information, so that you can kind of lift up their work.
Great. That's helpful. So we have actually, it's been a very active Q&A session. There's been so many questions, but unfortunately we're coming towards the end of this 1 hour conversation. But I will say YWCA and CanWaCH will be compiling the questions and also sharing it with the panelists. So should they be able to engage more, that will also come out in the follow-up. So please ask your questions, but if we won't be able to get to all of them today, but we will be doing our part to share it with the panelists so they can engage and share. So at this point, I'd like to first say thank you to all the panelists and all the audience members. This has been fantastic. And I'm gonna pass it over to my colleague Megan to close off this session. And thank you once again for attending and participating.
And thank you so much, Anjum, for such skilled moderation, and again, echoing the deepest thanks to all three panelists. It was such a rich discussion, and I don't know about you, but the last hour has absolutely flown by for me. And again, just thank you to all of those who participated today to take time out of your busy day to join us and engage on such an important topic. As we've been discussing, please watch for an email from us with the recording as well as resources after the webinar. And also, this is not the end of discussion, so please feel free at any time to reach out to us at the email address shown on your screen. And this is, an ongoing webinar series for CanWaCH, and certainly next week, please feel free to join us for a webinar next Wednesday called Engaging Canadians, CanWaCH Summer Update. Registration details will also be included in the following email should you or one of your colleagues care to join. So thank you again to everyone for joining us for this past hour. I wish you all well, stay healthy, and keep in touch. Thank you so much.